Bismillahirrahmanirrahim. Assalamu alaikum and welcome to Diplomatic Enclave. I'm your host, Mohamed. But we will talk about medical education as we have been doing in the last few shows, and how important it is not only in a country like Pakistan to understand the new concepts in medical education, but also to be at par and up to date with all the international standards of medical education, so that when the students from Pakistan go abroad, whether it's the United States or the United Kingdom or the Arab countries, they are proficient enough and can easily adapt themselves to the new environment and are updated with the latest information and the educational procedures and the ethical procedures as well that are as important as the educational is for those students. Now, to talk more about that, we've been talking in the last few shows with people from different countries. This time also, it's no exception. We've been graced by two people who've done a lot in their respective fields in their countries and other countries around the world. Without further ado, let me introduce them to you one by one. On my very right is Professor Hossam Hamdy. You're the Chancellor of the Gulf Medical University. You're a Professor of Surgery and Medical Education. You're a medical educator. You're a pediatric surgeon as well. You're not only a professional, but you're also a scholar and a leader in higher education in the Middle East. You've been working very diligently since the last 4 decades in different senior academic and administrative positions: Vice Chancellor, Medical and Health Science Colleges, Sharjah University, Director of Institute of Leadership and Higher Education, Sharjah University as well, Dean, College of Medicine, Arabian Gulf University in Bahrain. You're a consultant for the World Health Organization in medical education. You're a member of the editorial board of several journals in medical education. You've published more than 70 studies that are cited in all the leading medical institutions. And you've got numerous awards, and I want to talk about those: the Sheikh Khalifa Award for Higher Education for Distinguished Professor in Teaching. You've led the College of Medicine, Arabian Gulf University, and have won the Sheikh Hamdan bin Rashid Al Makhdoom Award for Best Medical College in the Arab World, Fellow of the Royal College of Surgeons of England by election in 2010, and Fellow of the Royal College of Physicians of England in 2016. And also, you've had the prestigious decoration by the Republic of France of the Chevalier dans l'Ordre des Palmes Académiques. That is also the Knight of the Order of Academic Palms from the Republic of France for all the achievements that you've done. So thank you so much,
but
Professor
I am now
Hamdy.
the Chancellor of Gulf Medical University.
Yes, but we have to tell all that you've done in the past as well, because that shows how competent and how much of an example you are for others to follow. Our second guest is Professor Mohamed Eraky. Mr. Eraky is currently working as a Director for Development and Academic Initiatives at the Vice President's Office for Academic Affairs at the Imam Abdul Rahman bin Faisal University in Saudi Arabia. You are a medical graduate, Master's in Clinical Pathology from Zagazig University in Egypt, then a Master's degree in Medical Education from the Dundee University in the United Kingdom. Then you did your PhD in Health Professionals Education from the Maastricht University in the Netherlands. You've done a number of publications you've written a number of publications on faculty development, curriculum development, assessment and medical professionalism. And there's something that's very interesting that you've written about is the 12 tips for teaching professionalism.
Yeah, exactly.
And the innovative models that we are going to talk about during the course of the show. You're also a visiting professor at the master's program at the Rifa and the Lahore universities in Pakistan. So this is not your first visit to Pakistan, and we are very happy that we have somebody who's a regular visitor to our country.
Thank you.
And you're also a member of the planning and assessment team from the Maastricht in 4 modules of the joint master's program in health professionals education between the Suez Canal and Maastricht. And also you are a tutor at the master's program for medical education at the Dundee University in the United Kingdom. Thank you very much, Professor Eraky, to have joined us as well. Let's begin with you, Hossam Hamdy. Is this your first visit to Pakistan?
No, it's my second visit, but first visit was to Lahore, but this is my first visit to the beautiful city of Islamabad.
Really?
I think it's the most beautiful capital.
For somebody who's visited so many different countries, how do you compare Islamabad with the other capitals?
Well, I loved it. It's green, clean, warm by its people of Pakistan. The scenery is fantastic, and it's a very nice place, I think, to live in it, in
All right.
Islamabad.
All right, all right. So we welcome you in Pakistan, we welcome you in Islamabad. This is not your first time, Professor Mohamed Al Eraky, and you've been to Lahore as well various times, which is a bit different from Islamabad, isn't it?
Exactly.
How have your experiences been in Pakistan?
It's a wonderful experience. I started 2012. And my colleague in the same office in the MAM University, Dr. Gohar Wajid, he invited me to launch a program, master program, first in Lahore and then in Rifa University. And I was very privileged to be among those people and the same group of scholars. And these two programs are perhaps transforming the medical education in Pakistan, I would say, because have been graduated so far, like more than 200 graduates that they are going to leadership positions, and it's a wonderful experience to be part of this great initiative, I would say, in Pakistan.
All right. Well, we welcome you to Pakistan, and we hope that you continue to visit our beautiful country.
Inshallah.
And continue to also bridge the cooperation and the friendship that exists between the Arab countries and our country, that is Pakistan. Let's begin with you, Professor Hossam Hamdy. Evolutions in medical education. When we talk about that, I talked to Trudy and Brownie about artificial intelligence. This is also something that you know much more than a lot of us about. Artificial intelligence, how important is that in your point of view in the current day and age, in the 21st century, so as to say, for medical students and also for the health professionals and for the teachers who teach to these medical students? What are the technologies you feel should be developed to apply artificial intelligence properly in the medical institutions, whether it be colleges, whether it be the hospitals?
Well, we have to understand that artificial intelligence is not the answer for everything.
But it is the recent update as far as the different procedures are concerned.
And I am not a software engineer. I am a surgeon, a practitioner. I'm very close to the patients with all these years of experience. But I was able to, even in my age, to absorb this new direction and to develop it into a product based on artificial intelligence. And we have to understand artificial intelligence so far, it is more of a pattern recognition, and then gradually is moving into machine learning, and it's advancing. But artificial intelligence or any technology is not going to replace the human relationship which exists between the healthcare provider.
It is going to help and support it.
Absolutely. It's going to enable the practitioner to fasten the decision-making process, accessibility to information, and things like that. The angle which I was introduced and I took it forward in artificial intelligence is how to use it in education. And in using it in education, mainly in simulation. So trying to mimic the real life patients. Because all this simulation which existed so far, even when people say about artificial intelligence, they either use cartoons or they used avatar and things like that, but not a human being. So we were able to bring human beings, and through artificial intelligence, there is a continuous interaction between the learner and the simulator, even to capture the most difficult part in simulation, which is the emotional component and reaction to the conversation which may take place between a healthcare provider, a doctor, a physician, a pharmacist, a dentist, but because they are working and dealing with humans. So this was the main challenge in how to use it so that the learners can learn things like what Professor Eraky is going to talk about more, about the professionalism, the ethics, the communication of bad news, and the reaction which can happen emotionally to the patient, and then using it as a tool for teaching and learning. Because we have been using, one of the main changes in medical education is using what is called problem-based learning as one of the strategies of learning. So the didactic lectures is getting less and less and less. So now with medical education is more about small group learning, being close to the patient as possible very early, working and learning and training in the real work environment. So the classrooms may disappear in the future in the way we are thinking. So we managed to bring this artificial intelligence and use it in education, and now it is implemented in many countries, several countries, this virtual patient VPL, what we call it. And today I was privileged to be running a workshop with my colleagues from Pakistan here. There were about 30 professors, and we were talking about it, and I think they will start using it in their own context.
Would you need to also supervise such kind of advancements in technology? Do you need to have a proper technician also along with the medical professional so that they can use the technology properly? Because it is nevertheless a technology, and there could be issues like HUNA's problems with it.
No, the products which is produced, because it's based on cinematography, so I'm used to this green screen behind me, and but you don't need a technician, but you need now all health professionals, and actually in all education, higher education, they have to understand a little bit about the technology, not to become technologists themselves, but to have an intelligent discussion, collaboration, and working with colleagues. I didn't have any background in computer science.
But you learned it.
But I learned it to a certain level to understand, but I was able to sit with other colleagues from Europe who are expert in as software engineering. Together we were able to take it forward. And this is going to happen, that always advances in knowledge and advances in creativity happens more with the interface between two sciences or two domains, even they are separate from each other. So you can find that this approach of artificial intelligence in learning, it can be in business education, it can be in law, it can be in any type where you want to get as close as possible to the real life.
All right. Getting as close as possible to the real life also does not exclude the humane element, because when you're a doctor, Professor Eraky, the first thing that your patient wants is to have that contact, that humane contact with him or her, that you as a doctor, as a professional, understand what the patient is going through. And as I also talked in my previous programs, a lot of the patients say that they get 50% better just by the way they are treated by the medical professional. Now, that brings me to the question, to point what Professor Hamdy had been talking about, ethics. It is very important in this day and age when there's a lot of superficiality, when a lot of people are also kind of inclined towards getting as much money as possible, that there be a certain ethics and rules to follow by the medical professionals while dealing with the different sets of patients. In the health professional, this whole arena of health professionals, how important do you feel is the role of ethics, and especially when it comes to Islamic countries? We know that our society is much more tightly bound because we value our elders, we value the people around us. There's a certain respect that we give, especially in the Islamic religion. So how much of that also do you inculcate, and I will use the term Islamic ethics, in the medical profession?
Yeah, excellent. The point of professionalism is a concept that is culture specific. That's why, as you mentioned, that in a culture like in Pakistan or in China or in Canada, they have different, I would say, expectations from physicians. And that's the key word of defining what's professionalism. It's, there are humanistic values, core values, like respect, like empathy, like altruism. But these values are interpreted differently in different cultures. For instance, patient's autonomy. When we had some studies on what are the expectations of patients in our culture, in Arabian culture, and then compared to the Western, for instance. The framework on professionalism from the Western may not fit our culture because of what you mentioned about the core values. So patient autonomy in the West may be not very highly regarded here, but the patient is expecting the physician to decide for him because he's coming to an expert. So imagine that a Pakistani physician is telling his patient or her patient, now we have like 3 options, like a surgeon, we have 3 options, and what do you think? Which one we can proceed? This is very acceptable in other cultures, but here there is something about physician's autonomy. That's the term actually we came up with in one of the studies. Another point about the core values that are revolving around the Islamic ethical principles. It's interesting that we found in the Arabian context there are other elements that have not been addressed in previously, before 2014 or something. The self-accountability, which you fear the surveillance, you fear like there is punishment, may not work as such, but it can work in the form of taqwa, which is exactly the term that we used in one of the studies. It's the 4 gates model. So we found that it's not only dealing with self and dealing with tasks and dealing with people, but there is another dimension for professionalism that emerged, which is dealing with Allah subhanahu wa ta'ala, dealing with God. And because of this, it will resonate with a nurse or a physician that about taqwa or about ihtisab. Ihtisab is like you expect reward from Allah subhanahu wa ta'ala.
Yes.
Exactly. This is exactly self-accountability is interpreted in Arabian culture, and I assume also it could be here, that this is ihtisab. That would make a nurse at the last hour of her shift still be accountable and still she can perform the task, even if the patient is not happy, even if the family are not happy with her. So she thinks that there is a reward later on from Allah subhanahu wa ta'ala, and that's why she keep on her duties. So taqwa and ihtisab, these are 2 elements that they did not emerge, and it has been published in this sense. So in the same year, we found it's like a trend, I would say, or a pattern of publication that are taking professionalism from cultural values. One of them in Japan, they are using the Bushido concepts. And one of them in China, they are using the Confucius values. So I would assume, I would encourage our scholars also here, that they need to find what are the core values that are pertinent to Pakistani context, and then they come up with their own framework before teaching or assessing professionalism.
When it comes to professionalism also, when it comes to ethics and the Islamic ethical principles, how can you also inculcate that in the medical profession while teaching the medical students and telling them, for example, to follow a certain rules? You know, accountability can also apply to the students while they are teaching, while they are giving an examination, so that they don't cheat, so that they also learn and understand in the proper mannerism, so they are also disciplined while they are attending different classes. Do you feel that is also applicable there?
Of course. I mean, teaching professionalism, it might be challenging, but it's applicable. And teaching is not preaching. You cannot say do and don't do and so on. That's why we had also a workshop this morning with our fellows about teaching professionalism. And in short, it's all about situated learning. You cannot just teach or tell them that you need to do this, you don't need to do this. But bring a scenario from their practice and then have a reflection on that scenario. Trigger have some questions to trigger reflection and ask them, so what? What are the consequences of these options? What would you do in this? What are other alternative decisions in the same situation? So people, they can like posing the situation and look from different angles. And then they can see they are being more prepared to deal with or handle these challenging situations in the future.
All right, handling challenging situations brings me to a very interesting topic that we discussed before the show began, Professor Hamdy, and that was medical journalism. Tell us a little bit about that, and how can laymen who are not related to the medical profession understand and kind of apply the whole concept of medical journalism in people and to the society around them?
Well, I got interested in that because I found, for example, reading sometimes a Newsweek or Time magazine. I don't buy them, but I read them on the plane. And I found that scientific articles are written in a fantastic way, and this is for the general public. And I remember I took some of this article which are written and I give them to the students because they are, in my opinion, better than what maybe someone was giving them in the classroom. That's one thing. So how to present in a highly scientific way, but in a simple way that the general public can read it and understand and benefit from it, is something we have to develop it more and more. That's one thing. The second thing, I get sometimes irritated when I read in newspaper the first operation on whatever, the best technique, the new technique, and someone advertise for something like that. The reporter, whether in the newspaper or in TV, or they must have some basic information principle, scientific. I don't want them to be doctors like you, but to understand how to ask questions, how to differentiate between someone who is saying, I have published in the best journals. So follow-up question, which one is that? Is it Scopus? Is it has an impact factor? It has, and then you discover it was published somewhere else. And so a little bit of science to understand about antibiotics, about cancer, about when you talk about genetics. So very, very small doses of medical sciences, and then how they can find out the information about that which are now available. Even the patient now, they go and read about it. So in order,
and with the advent, of course, Professor Hamdy, of social media, of the internet, you can just click any disease that you want, any kind of topic or from the medical education, and you have 1,000 articles from the different journals.
Absolutely. And even the information which are given to patients now are extensive. And so to develop this habit of how to do that, I try myself that if you want to spread the news about what you are doing, and it cannot be through an advertisement, it has to be you create news, but you create news in the proper way, and which will attract the attention of the readers or of the viewers, and it leave them at the end to think, and there is sort of confidence in whatever is said, and trust in the whatever is said during an interview.
Exactly.
So we're just starting this, and but I think it's going to pick up, and it's free. People have to take it and enjoy it, and I know how busy you are.
And also take it in the right vein. I think that's very important to understand an article properly, because sometimes an article is so scientifically written that a layman might not be able to understand what the different implications, and he might misunderstand or misconceive what has been written and sometimes apply it to people around him or in the society in a very wrong manner. This also needs to be stopped. And this is also, I feel, Professor Eraky, part of the medical ethics.
Yeah.
When it comes to ethics or when it comes to medical journalism, it all kind of intertwines to being a good professional, I think. Now, professionalism is one of the most important competencies of any medical professional, whether he be a teacher, whether he be a specialist, or working in any other environment, or a nurse for that matter. How do you teach professionalism in the medical profession? How do you assess whether a person, a professional, has understood the whole concept of professionalism?
Yeah, interesting. Professionalism, they might have two components, the cognitive part and the behavioral part. So the cognitive part, you can teach it like, and you can assess it in an exam, in a written exam. But the behavioral part, which is what they actually perform in practice, it has to be assessed in a workplace. So assessment needs to have these two components together. You assess the knowledge and the background, and I'm talking about knowledge not only about what to do or how to do it. I mean, you need to teach the legal aspects, the scope of practice. How many situations that the patient is asking or requesting the physician to perform an operation that he's not eligible for, that this is beyond his scope of practice. And because of this, he is performing beyond the privilege in the hospital, and if something is going fine, it's okay. It's good news for everybody.
But if some bad thing comes out of it.
The first person who might sue the doctor could be the patient. Because, I don't know, I mean, you perform it. So students and residents, they need to know the accountability issues, the legal practice in Pakistan, for instance.
And the boundaries within which they need to work.
Exactly. So this is all knowledge part. This is all cognitive part. For the behavioral, it is again about situated learning. So you teach them through reflection with using vignettes, hopefully from the local context. So people, they will come up with scenarios or challenging situations they have encountered in clinical practice, and they reflect about what could be done in this.
All right.
There are like 3 different or 4 different decisions can be taken. So there is, on professionalism, there is no clear right and clear wrong.
All right.
Or black and
That's
white.
very interesting.
Yes.
So there are some gray areas, as you say.
They are all mostly gray areas. And it's all about expectations again. So if a professional is practicing in Pakistan and move to another culture, if he's practicing the same, he might be unprofessional in the other culture. We had an interesting article about titled Becoming a Doctor in Different Cultures. This article had been authored by 4 people from different continents, 4 different continents. It's about a story of a Syrian Arabian doctor who went to practice in the Netherlands. It's an academic medicine. And what are the situations, the challenging situations she's encountering in the Netherlands, and she is now perceived as unprofessional? Yes, because sometimes it is not the way she has been taught in her culture. So again, it's context specific. It's all about contextual. Ethics, as you mentioned. Ethics is, yes, there are clear cuts usually in ethics. It is ethical, unethical. People, they know about it.
But then compared in different religions, ethics have different understandings and meanings as well.
Yes, but they all agree, all different faiths and religions, they agree that what is right, what is wrong, what is respect, that we need to respect.
All right. That's very interesting. We'll continue our discussion. Ladies and gentlemen, we are talking about medical ethics, about how professional one needs to be and how one needs to be universally professional as well, so that you can not only adapt yourself to any environment, but also be respected in any community across the world as a medical professional and as a medical student. We'll be right back after a short break. Stay tuned right here on PTV World. Welcome back. You're watching Diplomatic Enclave. I'm Umar Khalid Butt, and we are discussing the role of medical practitioners, medical educationists, teachers, and medical students in the medical profession around the world, including Pakistan, and how important is it also to inculcate the right values and the right ethics in them. Now, Professor Hossam Hamdy, medical education and healthcare are intertwined. Because if you are properly educated, if you have been educated with the right principles and the right ethics, then you become a better healthcare professional. How do you prepare future leaders in the healthcare scenario, in the healthcare profession, and because you are one of them?
Well, I think you are absolutely right when you say that medical education and healthcare systems are inseparable. Because the context, as Dr. Mohamed was saying, the context is very important. The system which they are going to work in it is very important. So the two are inseparable, and this has to be taken in consideration. The system in the United States is different from the system in the Netherlands, is different from the system
But there must be
Pakistan.
some common elements.
Yeah, well, the common elements is that you are improving the health of the population.
All right.
But that's, and I didn't say to cure, but it's the health in general. But as they are different in the way the economics related to this, in the way the payment related to this. All these are systems. And we have to prepare those who are going to work in this system, how the system works. Now there is what's called system sciences. I've talked about a little bit about technology and advancing technology and all the advances in the technology in practicing. But all these technology are changing in a very fast way. But the whole ecosystem of the education and of the medical practice is changing at all levels. At political levels, at economic levels, as everything is due to what they call them disruptive forces, access to information, communications, and so on and so forth. So all this has to be taken in consideration, and we have to inculcate a lot of this principle very early. So the direction now in medical education, for example, is to expose the learner to the future work environment very early. They will learn by being embedded in this environment. They will learn about the good things and the bad things, and we have to reduce the bad things, bad ways of doing things. All the issues of professionalism, they have to see the role models. But the principle is put them in the workplace, the future work environment, and then they will learn supported by all this technology which is taking place. So over the years we have been trying to go away from the usual practice of teaching of there is someone who is talking to the learner or to the students. This is disappearing now. We talk about small groups learning. The role of the changing the role of the teacher from an information giver to a facilitator of learning, in how he wants to bring the students to become as close as possible like him, as a good model. Talking about, again, because professionalism is in everywhere, I was talking to my students recently and I told them there is no exam in many things. I hate exams, and I think all the students hate exams. But I asked them to go, it was in a dialysis unit. And the patient in dialysis, as you know, they stay for an hour or 2 hours hooked to the machine. So this is a wonderful opportunity from the perspective of learning, is to ask the students to take a chair, even first-year students, and go and sit next to this patient, introduce himself, and chat with him, just talking.
Excellent.
How this disease has affected his life, his family, from where he can afford the money to pay for this, who pays for it, is it free, how he feel about the future, and just that's what they call it, narrative medicine, just talking and learning while talking, and then capturing this and writing about this and bring it back and discussing in small group their personal experience with patient. And this keep going and going till it become part of themselves.
And part of the whole system, so that they also understand and inculcate that properly, and it kind of seeds into their system.
Absolutely. And when we talk about professionalism, to Mohamed, definitely the main part is related to the relation with the patients. But there is also the professionalism of the healthcare provider, because if he does not continue developing himself, learning, raising his competences,
How can he teach his students properly?
it's not only the teaching, how he can treat the patients in the
Exactly.
proper way. He has to be up to date about, and that's what's called continuing professional development. So it has, and if he doesn't do that, so this is unprofessional behavior, because he's not up to the level of providing the best possible treatment or support to the patient. So that's why professionalism in talking to his colleague. Now the medical practice is not based on a doctor. It's a teamwork. How this team function. So now it's a team-based healthcare system where the patient is in the center, but everyone, the nurse, the pharmacist, the technician, the administrator, and the physician, they all are providing service. And if they don't work in harmony and they don't respect each other and understand the role of each one,
The system falls flat.
the system will fall and the patient will not receive the best treatment or therapy. So now, in summary, that now teaching is more at the workplace than it used to be in the classroom. The healthcare is more of a team rather than an individual who is presenting or providing the care. And this system, they have to work together, because you can have all the advances in technology, and then when you apply it in the system, which is failing, everything is going to be a big failure, because the systems, they don't talk to each other. System of education doesn't talk with the system of health. It doesn't talk with the system of economics. It doesn't.
And they all have to be interlinked, because until and unless they are not, the whole system cannot work in the proper and efficient manner that it needs to.
Absolutely.
All right. Professor Eraky, you have taken out 12 tips for teaching professionalisms along with innovative models. I really want you to talk about that, because I found that so interesting while I was reading them.
Thank you very much. First, I would like to capitalize on the point that Professor Hamdy mentioned, that about the systems and the interprofessional education. There might be a dilemma in medical education worldwide. This dilemma that we are teaching our students and then we are assessing graduates as individuals.
All right.
So we're giving grade to each and every individual. So this will not contribute to how they interact with others, other disciplines in the hospital, because the hospital, they are full of other functions, other disciplines. So there is now a trend in assessment that we need to assess graduates not as individuals, but also as in a group. How they have the harmony together, how they have communication together, dealing with the hospital information system, dealing with their colleagues. Documentation is a big element now in the legal practice and the hospital practice. So all of these points, they have to be acknowledged in the medical schools, so people will be assessed in a group in the workplace. Okay, so talking about this. Now, about tips, 12 tips is a section in medical teacher that usually that people, they write some tips how to teach something or how to assess something. So it was interesting that part of my PhD from Maastricht, that we come up with these 12 tips. It's about, first you need to acknowledge the context again and the culture and come up with your own framework. And then you develop different strategies for teaching professionalism at different levels. For instance, you start teaching professionalism on the first day of medical school, the admission itself. How they have a white coat ceremony in some universities. So people, they feel like doctors.
When they put on the white coat.
Even before that, I mean, once they have the results, and then they will be a doctor. So now they receive some consultation. They are receiving some complaints from their relatives that what should I do and so on. So this developing the professional identity of physicians or health professionals, it starts early on at the first day. That's why, as Professor Hamdy mentioned, that to put them in practice early on, from first year or maybe first week, so they will feel more accountable as physicians, and they try to meet the expectation of the society. The journey goes up to continuing professional development. There are some strategies in undergraduates, some other strategies in postgraduates, up to continuing professional development. So it's all about developing the reflection, the skill of reflection on vignettes or on situation that you are encountering. And one of the last, maybe the 11 or 12 tips is about professionalism in the social media. If your patient sends you an invitation as a friend on Facebook, would you accept it, and why? What are the boundaries between personal life and professional life? So,
and should there be boundaries between the two? That is also a huge question.
Yes, there are, because there are different conflict of interest that might happen because he became a friend too close to you. It's like, I mean, there are, in some cultures, there are certain boundaries. We call each others like doctor or something. In other cultures, they don't. So we need to respect this one, and we need to acknowledge that there is a new era of professionalism, on the e-professionalism, they call it, or digital professionalism, that's related to social media, Facebook, Twitter, WhatsApp group. Would you make a WhatsApp group and send to other colleagues, patients, information? So these are questions need to be discussed.
Have they been discussed worldwide?
Yeah, exactly.
And what is a general criteria of assessment or of understanding these points that you've just talked about? For example, this whole distance that needs to be or not to be between the medical professional and the patient, or between different medical professionals. Has that been applied in some of the countries?
There is a joke in health professional education or medical education that whenever you receive any question as a professional in education, you start your answer by, well, it depends. And then you continue. Because this is actually the real answer, because it depends on so many variables. What is the relation between you and the patient, the seniority level, so many variables that you cannot have ground rules across all boundaries, particularly in area like in professionalism.
All right. Professor Hamdy, international accreditation bodies are there all over the world, which set and implement standards and benchmark in the health professional institutions in different countries, Asia, Europe, America, and so on and so forth. How important is their role?
I think they have a very important role, accreditation bodies, because accreditation bodies can lead the progress and the improvement and the changes in the country or in the region which they are responsible for, or they can stiffen it and hinder any progress. So the regulation and the standards are usually should not be very rigid.
All right.
But should take in consideration the context. But there are some minimum standards which has to be present, and should not be only based on quantitative measurements, of measuring how many hours of teaching of this or how many hours of this course should be given. It should be mainly based on the outcome and outcome competencies which has been identified as this, what a graduate of this program should have as abilities and able to do, rather than how much he knows. So it's the ability and the competencies, not the amount of knowledge. At present, in many situations, we measure what we can measure, and that's why we are measuring more outputs but less outcomes, because it takes longer time to do it.
All right, when you talk about longer time to implement models, very few schools, medical schools in Pakistan, I'm sorry to cut you short, use the SPICES model and the change of curriculum to integration only. Now, how important are these and other components of models such as the SPICES model to be implemented in schools, medical schools in Pakistan?
Well, the SPICE model is, which was described by Professor Ron Harden. It was developed maybe 20 years ago, and the idea was to have more of integration in the curriculum. It is not subject-based curriculum, more of the student-centered learning rather than a teacher-centered learning, more assessment of competencies and knowledge and so on. So it has different components, as I would say, which are in alignment with the new trends in medical education as how we should educate our students. But even this is changing, and we are understanding that, for example, integration per se, it is not an aim. It is not just to integrate, but it is one of the strategy to achieve certain aims at the end, and so on and so forth. It varies in its implementation from one country to another, from one medical school, but it is generally, it means that the college is in the process of continuous evolution and changes, introducing change, either in their program, in their curriculum, in their strategy of teaching and learning, in the technology, in the physical facility, which has to be adaptable to the strategy of learning, into the assessment. So everything is changing, and now here comes the technology, which is becoming part of how much the e-learning technology, which is now in should be in almost all medical schools or all higher education programs. Communication, accessibility to knowledge and to information. Like my newest library, which I have developed, is a food court. So the food court now, the students, they capture, live and learn. So it's 24 hours while they're eating. They have their computers, they have small spaces. So the physical facility even is changing. So the SPICE model, when it started, it was pushing to change, and this is what has been happening. And but the whole environment is changing.
All right. The whole environment is changing. People are adapting to new procedures, to new techniques like the food court that Professor Hossam Hamdy has very effectively talked about it. I think we should implement it here because we love food. I can tell you that, Professor Hamdy, and I'm sure that you all love food as well. Finally, Professor Eraky, what are the challenges that remain for the health education professionals in Pakistan, because you visit Pakistan very often, in Arab countries and in other countries of the world? And can we implement the innovative models that you've introduced, such as a curriculum navigator, compass model, 4 gates model for professionalism in the Arabian context, which are being used in some of the countries?
Well, interesting. Going back to your argument about the global practitioner, there might be global challenges, not related only to that's a good news.
Countries,
yes, specific countries like in Arab countries or Pakistan. In health professions education, there are at least two, as far as these are the two major drivers that makes disruptive change, as Professor Hamdy mentioned. The one of them is the evolution of learners' demands. Students, they have different demands now. They don't want to go to a session to sit for like 2 hours on a lecture because they can access information from different ways. So they are going to a lecture or to a session for a different purpose, for getting feedback, for clarification of some concepts. So their demands, learners' demands, are different. Okay. The other also challenge that is happening in the societies. You've mentioned something about the patient, they can access information. So most of the patient going to physicians, they go after reading Wikipedia and reading
exactly,
so
and all
many
the different
things about the
websites that are
disease.
available and accessible to them.
And that makes them, they call them the better informed society. Those better informed society is another challenge. So as health professions, you are dealing with your two stakeholders, many stakeholders, they have evoluted. The learners or students, they have different demands, and the patients, they have different expectations.
Because sometimes, you know, sometimes what happens is that the patient comes to you and says, no, so, doctor, I think I could have this and this as well because of the A, B, and C symptoms that I have. And the doctor will say, where did you read that? And you'll say, I went to this website, this medical website of this university, and they said if you have these symptoms, you could have these or these diseases. So the differential diagnosis is now more understood by even the patient than it could be by the doctor. Before the doctor even tells you, the patient says, oh, I could have this or that. So how, what kind of challenges in that environment come to the health practitioners and also health educationists in order to properly implement this medical education in different criteria?
Yeah, that's why medical schools, they have to be responsive enough to these challenges. The better informed society and the growing demands of learners or different demands of learners. And of course the technology now that is happening in the procedures and in the learning and education and assessment, like e-assessment and these things. So medical school, they need to acknowledge these challenges and have a very fast response to that.
All right.
Thank you very much.
So teachers, students, medical practitioners, health professionals all need to be updated on the latest technologies, and they all need to integrate in a system that not only involves the health professionals but other professionals as well, so that the system does not collapse and it only goes forward. And there are so many techniques that we have discussed today, Professor Eraky and Professor Hossam Hamdy, that could in fact evolve the whole medical profession, whether it be the teaching or the application of that teaching process, so that people around the world can get quality healthcare and quality education, maybe in a few years' time at their doorsteps, in their rooms, or in food courts, as you've put it. So thank you very much, Professor Hossam Hamdy, Professor Mohamed Eraky, to have given us an insight into the future of healthcare education, the future of healthcare practitioners, and also the integration of the different systems in order of all that to survive and become even more stable, not only in Pakistan, but across the globe, and that's very important. Ladies and gentlemen, we had a very interesting, innovative and futuristic discussion on health education and how important it is and how we need to integrate the latest technologies and how we need to work as a system with other professionals in order to improve ourselves and in the long run to improve our society and our nation. That is how progress comes up. That is how countries get developed. That is how countries get bound together in different forms of cooperation, whether it be in education or health practitioners. Umar Khalid Bad bids you farewell from this very interesting episode of Diplomatic Enclave. We'll be back inshallah next week, same time, same channel. Thank you very much to have been with us, and Allah Hafiz. And Professor Hossam Hamdy, thank you very much.
Thank you.
Professor
Thank you, Omar.
Thank you very much.